Planned Parenthood, Eugenics, and the Black Community, a comprehensive history. Founding and early history. Planned Parenthood's roots trace back to 1916 when Margaret Sanger, a prominent birth control advocate, opened the first birth control clinic in Brooklyn, New York. Sanger's mission was to provide women with the means to control their reproductive health, driven by her experiences with the negative impacts of frequent childbirth and unsafe abortions on women's health. Margaret Sanger and Eugenics. Margaret Sanger is a polarizing figure due to her involvement with the eugenics movement. Eugenics, a pseudoscientific belief that aimed to improve the genetic quality of the human population through selective breeding, was a widely accepted concept in the early 20th century. Many eugenicists believed in controlling the reproduction of those deemed unfit, which often included immigrants, the poor, and racial minorities. Sanger supported the idea of birth control as a means of preventing hereditary illness and reducing the birth rates of what were considered undesirable populations. Although Sanger's primary motivation was women's rights and health, her alignment with eugenics has led to significant controversy, particularly regarding its implications for the Black community. Impact on the Black community. During the mid-20th century, Planned Parenthood expanded its services to underserved communities, including Black neighborhoods. This expansion was part of broader public health initiatives to provide family planning and reproductive health services to all women. However, the historical context of eugenics and the disproportionate focus on Black communities have fueled ongoing debates, criticisms, and controversies. Critics argue that the placement of Planned Parenthood clinics in predominantly Black areas was a continuation of eugenicist efforts to control the Black population. Prominent Black leaders and activists expressed concerns about the potential for coercion in family planning programs. Fannie Lou Hamer, a civil rights leader, spoke out against the forced sterilization of Black women, highlighting the darker aspects of reproductive health policies. The fear was that family planning services, while beneficial, were also used as tools of racial and population control. This concern was not unfounded, as there were instances of forced sterilizations and other coercive practices aimed at reducing the birth rates of marginalized populations, including African Americans. Modern perspectives and reproductive justice. In recent decades, Planned Parenthood has sought to distance itself from its controversial past and reframe its mission around comprehensive reproductive health care. The organization provides a wide range of services, including cancer screenings, STD testing and treatment, contraception, and educational programs, emphasizing health equity and access for all women. The reproductive justice movement, which emerged in the 1990s, was pioneered by Black women activists who sought to address the intersecting oppressions of race, class, and gender in reproductive health. Reproductive justice goes beyond the pro-choice, pro-life dichotomy, advocating for the right to have children, not have children, and to parent children in safe and healthy environments. This movement critiques both historical and contemporary reproductive health policies and practices, including those of Planned Parenthood, for not fully addressing the needs and rights of marginalized communities. It calls for a more holistic approach to reproductive health that considers the social, economic, and political factors influencing women's choices. Conclusion. The history of Planned Parenthood and its relationship with the Black community is complex and marked by both advocacy and controversy. While the organization has played a significant role in advancing reproductive rights and healthcare access, its legacy is also intertwined with the troubling history of eugenics and population control. Understanding this history is crucial for addressing ongoing disparities in reproductive health and ensuring that all communities have the resources and support they need to make informed reproductive choices. In recognizing and learning from its past, Planned Parenthood and other organizations can work towards a more equitable and just future for reproductive health care, where the rights and needs of all individuals are respected and prioritized.